Okay. Hello, my name is Sydney Lease. I'm a BSN1. Here's my ID badge. And we are going to do a Part 1 assessment today.
Hi, I'm Chloe Spoon, and I consent.
Okay, so we're going to start off by I'll wash my hands. I'm going to introduce myself. So hello, my name is Sydney. I'll be your nurse today. We're going to identify the patient with 2 identifiers. So name, date of birth, or wristband. I'm going to explain the procedure to them. So today we're going to be doing an assessment on your head, eyes, mouth, neck, abdomen, thorax. I'm going to give the patient some privacy, and then I'm going to apply gloves if necessary. So, do you have any history of COPD?
No.
Do you have any history of asthma?
Nope.
Okay. Patient seems to be alert and oriented. So, what's your name?
Chloe Spoon.
Do you know where you are?
At your house.
Do you know approximately what time it is?
1:30.
Okay. And then do you know why you're here?
For an examination.
Okay. So patient is alert and oriented times 4. And how are you feeling today?
Good.
Okay. And then do you have any issues or problems right now?
Nope.
Okay. So patient seems to be mood appropriate. They are clean and well kept. Speech is clear and articulated. So I'm going to look at her face. Her eyes are symmetrical to each other. Her ears are symmetrical. Her nose is midline. And then the corners of her eyes are symmetrical with the top of her ears. So I'm going to have you smile for me and frown and lift your eyebrows. Okay, so with all those facial expressions, her face was still symmetrical throughout. And now I'm going to look at her face. It's a beige tan color with a pink undertone. And then no lesions or anything like that can be noted. Her hair is clean, dry, well kept, no bald spots, no parasites, it's evenly distributed throughout. So now I'm going to move on to your eyes. I'm going to have you lift up. Okay, and then down. Okay, so her sclera is white evenly throughout, and then her conjunctiva is pink and moist, which is a good sign. And then I'm going to have you follow the tip of my pen. Don't move your head, please. Okay, so eyes did move symmetrically, and I didn't note any nystagmus. So now we're going to look at her pupil size. Just look straight ahead for me. Okay, that one was about 4 millimeters, and then the next one was again 4 millimeters, so they are even and good. Okay, so I'm going to have you look over this shoulder, and then I'm going to check your pupils for constricting with light. Okay, and now the other shoulder. Okay, so in direct light, they do constrict evenly. I see no differences. They are symmetrical. And now we're going to do indirect light. So I'm going to have you look over my shoulder again, and we're going to do, I'm going to look at your other eye that's not light shining. Okay. Okay, and in indirect light, they do constrict symmetrically again, no issues seen. Okay, so I'm going to have you watch the tip of my pen light again. I'm going to move it towards your nose, and if your eyes go cross-eyed or anything, that's normal, so don't worry about it. Okay, eyes were symmetrical. They did converge, which is normal. That's a good sign. So next we're going to look at her lips. They are a pink color. There is no lesions, no cracks, no anything. I'm going to have you smile for me with teeth, please. They are white. They're all intact. Do you wear dentures?
No.
Okay, great. I'm going to have you stick your tongue out for me. Okay, tongue is pink and moist. No lesions or cracks noted. Okay, let me get my thingy out. I'm going to have you say ah. Oops. Hang on. I need my light. Okay, so I looked at her tonsils, and they were evenly spaced, no swelling, no redness, anything like that. So I would consider them a grade 1. So now I'm going to look at your neck. May I palpate your neck, please?
Yes.
Okay. So, trachea is midline. And I don't feel any lumps or bumps or any lesions on it. She is sitting upright right now. There's no... she's using her... Wait, can you take a few breaths for me, please? Mm-hmm. Okay. Watching her breathing, she is using her diaphragm only. She's not using other muscles like a sternocleidomastoid mastoid or anything like that. So that's good. No abnormal findings. So now I'm going to have you take your shirt off for me, please.
Mm-hmm.
And I'm going to move the camera while she does that. Okay, perfect. So I'm going to have you face that way for me.
Mm-hmm.
May I palpate your back?
Yes.
Okay. So I'm looking at her spine right now. It is in the middle of her back, and it is straight. There's no curvatures or anything like that. So now I'm going to put my hands right here. I'm just going to have you take a deep breath. Okay, my hands did flow outward, so there's about a 1-inch gap right there. So now I'm going to listen to your lungs and stuff like that. Oh, my stethoscope's caught. Okay, so I'm just going to have you breathe in through your nose and out through your mouth every time I move the stethoscope and stuff like that.
Okay.
Oops. Go ahead. Okay, breathing was bilateral. It was even. I didn't hear any crackles or wheezing, so that's a good sign. So now I'm going to do the same thing on your front side, if that's okay with you.
Mm-hmm.
Okay. I'll just go under. Okay, and then okay, again, sounds were even bilateral, no wheezing or crackling again, so that's a good sign. I'm gonna have you lay down on your back now.
Mm-hmm.
I'm gonna move the camera again. Okay, I am going to drape you. Hang on. Sorry. So we're gonna put one right here, one right here. I don't want it to get in your mouth. There you go.
Mm-hmm.
Hang on, I might need to. Okay, that should be good. Okay, so I'm gonna look at all 4 quadrants. They do look symmetrically the same color, a pale tan color. No lesions or anything that I see. Her umbilical is inverted with no drainage that I see. I'm looking at her contour and it is flat. There's no bumps or raises or anything like that. And so, do you have any pain or tenderness in there?
No.
Okay. So I'm just going to listen to your bowel sounds. Okay, so I did listen for bowel sounds, and I did find about 7 bowel movements when I was listening, which is completely normal. The normal range is 6 to 30 bowel movements, so she's a little bit on the lower end, but that is okay. And then I'm going to palpate your abdomen. Okay, any pain or tenderness when I touch any part of that?
Nope.
Okay, so I did notice that it was tender and the same throughout. There was no pain. She didn't flinch or anything like that. So abdomen checks out. I'm gonna have you sit up for me if you could.
Mm-hmm.
Okay, and I'm gonna have you face the same way. Just that way.
Oh, okay.
Can you scoot up that way a little bit? Thank you. Have you ever had any issues with your kidneys?
No.
Okay, so I'm going to. Any pain or tenderness?
Nope.
Okay. Any pain or tenderness?
Nope.
Okay. So, overall, that would end the procedure. I would make sure that the patient is comfortable. The call light and items are that in reach for her. She has a safe environment. I would make sure that the bed is in the lowest position. The bed rails are up 2 times, and then I would make sure that I would document my findings and stuff like that. So that is all.